Now it's time for On Point, where we speak to experts to delve deeper into key issues in the spotlight right now. Now, with most antivirus measures lifted, the health authorities are set to lift even more measures moving forward, including the mandatory 7-day quarantine for infected patients.
However, is the country ready to bring in these measures considering the persistently high number of cases, as well as concerns over Omicron subvariants? To get an insight on these issues, we connect with Dr. Alice Tan, internist at MizMedi's Women's Hospital. Very good morning to you. Now, first off, health authorities are set to lift more antivirus measures, including mandatory testing and the mandatory 7-day quarantine for infected patients. Now, what do you make of this decision?
Well, right now, all of the risk assessment factors are improving in South Korea. We have the number of new cases continue to go down, new admissions are decreasing, new ICU cases are decreasing, and perhaps most importantly, the number of new cases that are age 60 and older is also consistently going down. Now, the only factor here that I think is a red flag is the number of people who are 60 and over who have received their 4th dose, so the second booster, is really only at around 24%. So that's the one aspect that I think is a little bit worrisome. I do hope that the trajectory continues, even if the testing and quarantine procedures are no longer mandated. That doesn't mean that they're still not good ideas. So I hope that administrators, leaders, employers stress that to the people who are working for and under them, that it's never a good idea to have an infectious person at work or at school. And so if a person has symptoms, they should still get tested. If they have any suspicion or they're a close contact of a positive case, they still need to stay at home. It's just no longer going to be a mandate. But I hope the public maintains good sense and responsibility and they continue to do the right thing.
I guess the one person who has been very much against those plans was Yoon's transition committee chief Ahn Cheol-soo, right, who had criticized the lifting of the measures, saying, it was too early and that decisions should kind of be measured scientifically. So what would be the right move to make at this current state, I guess, based on science then? Dr. Donna, if I guess you didn't hear this once again, let me just repeat the question once again.
You.
Okay, so what would be the
Sure.
best, I guess, decision to make based on science, so to speak?
Right, so the parameters that we're looking at are hospital capacity, the amount of protection in the community, especially among the most vulnerable groups, also whether or not we have good and low transmission levels overall, and then the presence of new threats. Those would be new variants that might be in the community. And those are the things that we're looking out for right now. And as I said, except for the fact that only 24% of people who are older than 60 have received their 4th dose, and perhaps also a low vaccination rate among children, other than those two factors, I think the rest of the country is ready to move on and to continue to lift mitigation levels at this time.
And Dr. Tan, there's been a rising number of cases among those 18 years and under. Now, how serious is the situation?
Well, if we look at the numbers week by week, as a trend, I think that we can see that even cases that are aged 18 and younger is decreasing overall. Now, May 10th was the peak number of new cases among pediatric population this last week. But if we compare the number from May 10th to 1 week prior, that's actually 1,000 cases fewer. And last week's number compared to 1 week before that is 1,800 cases fewer. So overall, the number of cases in children and adolescents is decreasing. But as I said, less than 2% of children aged 11 and younger have received the first dose of vaccination. And unfortunately, on May 14th, marked the death of another child in the pediatric age group. That's bringing our number of deaths in this 18 and younger age group to 30 now. And so we do need to be very, very careful. Any diagnosis of COVID in a child, even if it doesn't lead to death, can be devastating. The isolation, they're having to miss school. These are all things that we need to take into account. Also, children are at risk for long COVID, just as adults are. And so even though there is a decrease in the number of cases overall, we do need to drive the number of children who are getting COVID, drive that number further down. Right now, it's still in the thousands, and that's simply too many.
Yeah, I mean, the misconception at this time is the fact that if you're young and you get COVID, everything is going to be okay. There's no symptoms and so forth. But certainly looking at the numbers, it is very concerning. Dr. Tan, I want to kind of briefly touch upon the recent global COVID-19 summit. Obviously, world leaders are, pledging to assist in tackling the ongoing pandemic. As a doctor, what do you think is needed most right now to help fight the prolonged pandemic?
Right. So the Global Health Summit that was held on May 12th, the main outcomes were to try to prevent the complacency that we're seeing in many parts of the world regarding the pandemic, stressing that the pandemic is still not over. We also want to protect the most vulnerable members of the global community. That would be the elderly and frontline healthcare workers. And then we also want to prevent, of course, future catastrophes, another wave, or another pandemic. I think the most important thing right now is to turn vaccines into vaccinations. And we can do that by making sure that vaccines are available, that they are accessible, and that they are attractive. In other words, we need to continue to convince people who may be hesitant that they do need to get vaccinated. And this is actually proving to be very difficult, but this involves a strong information and communications campaign, making sure that we use community ambassadors to get the message across, make sure we engage the public, listen to their concerns and address their concerns, and convince everyone that the benefits far outweigh the risks of vaccination. And we really do need to vaccinate everyone in every corner of the world in order to get over this pandemic.
Well, thank you very much, Dr. Alice Tan, for your insights. We'll speak to you again next week.
Thank you.